So first sign is the von Graves sign. You can just remember it with the word G. Okay, so there is a G here. So what it means is that when the patient looks down, usually what happens is when the patient looks down, the eyelid also follows it. Okay, but in the patients of thyroid eye disease, when the patient is looking down, the eyelid is not following it. Okay, so G, you can just remember it. G goes with ground. So we have a lid lag on down gaze. Okay, that is how you can just remember von Graves sign. The next sign is Enroth sign. So here the trick is E. So E goes with edema. So we have a puffiness of the lid or edema of the lid. Then we have the Joffre sign, only sign which you have to just cram it, that this is the absence of lid creases. Again, Stilwell sign, you can remember it with still. Still means it is not moving. So Stilwell sign means that there is stillness of eyeball. There is restriction of the movement of the eyeball. Delrimpes. This is the most common seen sign, lid sign of thyroid ophthalmopathy. So Delrimpes sign means, you can remember it with the Hindi word dar, daravni. Okay, so we have retraction of eyelids, okay, because of sympathetic stimulation. Then again we have Mobius sign, you can remember it with M. Okay, so M means medial. So here what is happening is medially eye is not able to move. Okay, so what we tell the patient, when the eye moves medially, when we have to converge. Let's say I'm seeing this pen, okay, and when I'm seeing this pen, this is what my accommodation is basically going on, and with accommodation my eyes move in medially. So this is decrease in the ability to converge. Last but not the least, I would like to have your attention towards the intraocular pressure effect of thyroid ophthalmopathy. When I was talking about the risk factors of primary open angle glaucoma, I told you a thyroid eye disease is a risk factor for primary open angle glaucoma. So remember, in these cases, the IOP may be normal in primary gaze, but when patient moves the eye, in that cases there is an increase in the intraocular pressure. So increase in intraocular pressure on eye movement, a very important point to understand. So they would basically ask a clinical based question in this way, that a patient came, he has the pressures of 24 millimeter of mercury when he looks up and 18 millimeter of mercury when he looks straight. So what is the condition the patient might be suffering from? So the patient might be suffering from thyroid ophthalmopathy. So we are talking about the increase in the volume of extraocular muscles in thyroid eye disease. So let us learn more regarding the involvement of various extraocular muscles. So you can just remember that these muscles get involved in a fashion in which the first muscle to be involved is inferior rectus and you can remember it with the mnemonic IMS Lucknow, followed by medial rectus, superior rectus, and L goes with the lateral rectus. Okay, this is the order of involvement of the extraocular muscles, and after this we have oblique involvement. The most common question they ask is that which is the first muscle to get involved, and that is your inferior rectus. Okay, now sometimes they ask which action is basically involved first. Okay, here is the muscle involvement, then it is the action involvement. So remember, the first action to be involved or decreased, that is your elevation. This is the first thing that basically is hampered. You would ask that, sir, when the inferior rectus is first involved, why the elevation is the first involved action? Remember, the muscle involved is inferior rectus, but what happens is there is a fibrotic contracture of inferior rectus, and what it does is it basically mimics a SR palsy. Okay, so that's why the first action that is involved, that is elevation. Okay, the patient would not be able to elevate the eye. Then the second action involved is abduction, followed by depression, and last is adduction. But if you have to remember just one, please remember the elevation is the first action that is basically involved. Okay, so let us investigate a patient of thyroid eye disease. Definitely, if we are given with the clinical signs, the first thing that we would do is we would basically ask for thyroid profile. So that was a previous year question as well, where they have asked and first told you about the various clinical signs of thyroid ophthalmopathy, and they have asked that which of the investigation would you like to order. So the first thing that you would do is a thyroid profile. Definitely you would basically check intraocular pressure, because that is very important in these diseases. This is a risk factor for primary open angle glaucoma. Look for the fundus, because in the advanced cases of thyroid ophthalmopathy, there can be an optic nerve impingement which can lead to disc edema. And you would say, sir, why you have put a Coke bottle here? Because on radiological imaging, you would get a sign which is called Coke bottle sign. So what is Coke bottle sign? Like a Coke bottle, your muscles would be enlarged like this, where the belly of the extraocular muscle, that would be large with a tapering. Why there would be a tapering? Because the tendons are spared. I told you earlier also, the tendons are spared in the patients of thyroid ophthalmopathy.